Come with me, and you'll see. I wanna be. Open my mind. I can be that I wanna be. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Open my mind. I can be that I wanna be. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Open my mind. I can be that I wanna be. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Open my mind. I can be that I wanna be. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Open my mind. I can be that I wanna be. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Holy name university. I wanna be. Open my mind. I can be that I wanna be. Realizing dreams.
Good afternoon, everyone. Welcome to another episode of the InFocus series of Holy Name University, brought to you by the Marketing and Advertising Office. InFocus is a series of virtual panel discussions and conversations about current, up-to-date, relevant information of the programs and course offerings of Holy Name University. This is live on our Holy Name University official Facebook page, asynchronously later, and the video files will be uploaded in the Holy Name University YouTube channel. The audio files will be uploaded in our or aired in our very own Johnson Radio, DYJR 106.5 FM in the Metro Tagbilaran area. This afternoon, the InFocus episode is on the newest and youngest program of Holy Name University, which is the Bachelor of Science in Radiologic Technology. And of course, with us is the youngest also of the College of Health Sciences, the program head of the BS Radiologic Technology program. So we have Ms. Raynadel Dinorog with us this afternoon on the hot seat. So without further ado, may I introduce Ms. Dinorog, who is the program head on the hot seat this afternoon. Thank you for joining us, and I hope that we will be able to share a lot of information with our audience, our parents, our students, enrolled, and future enrollees. So good afternoon, Ms. Raynadel Dinorog. Welcome to
Good afternoon, Ma'am Vera. Yeah,
Welcome
in
to
focus.
InFocus. Yes, thank you very
Thank
much
you.
accepting the invitation to be this afternoon's guest in the InFocus episode. This is our 25th episode since we started in of this year. So without further ado, I'd like to ask you a couple of questions with regards to this new program of Holy Name University. Before anything else, may I ask you to tell us about yourself, your how young you are, your personal life, your education, your career, stuff that you can share and tell our avid followers and viewers, our Facebook likers. Yes.
My life is simple. Let me start it with my name. I am Raynadel B Dinorog. People call me and refer to me as Nads for short. And then I'm a mother to Aya, a sister to 6 siblings, a daughter to Mr. Mihio and Mrs. Edelisa Dinorog, and I'm a friend to all and a child of God. I am honed and born here in the city of Tagbilaran, and tracing back my educational years, I took my primary and secondary years in Holy Spirit School of Tagbilaran before our building was in the near, it's the Taskas building now, if I'm not wrong. And then in Remolador. And then I took my bachelor's degree in Cebu Doctors University and graduated last 2015. Right after graduation, we had a board exam. It was July or August in the 2015, and then I passed the board exam on the same year. Tracing back my professional growth, by the way, right now I'm taking my master's degree in Davao Doctors College, taking up master's in Radiologic Technology. And I was a red tech before I became a professor here. I worked 2 years after passing the board exam. I worked 2 years in Mactan Doctors Hospital as a red tech there, handling X-ray and CT scan. And then right after about 2017 of December, I was employed in Ace Medical Center Bohol in the imaging department as an assistant chief rad tech, handling the modalities there, assisting in ultrasound procedures with our radiologists. I was also able to handle mammography, magnetic resonance imaging. I was also given the chance to handle general and fluoroscopy imaging and C-arm machine. After that, there was an opportunity given to me to join the Holy Name University family. It was offered by Dr. Orlando Bertulfo, our radiologist. And then with my passion of teaching, and of course, I also worked as a part-time instructor in Cebu Doctors University way back when I was also working in Macron Doctors Hospital. So I can see my passion in teaching. So there, I entered in the Holy Name University family, and I was warmly welcomed here. Basically, that's all about myself.
Well, thank you very much. You must be pretty young. Because
27.
you graduated in 90, you were born 95, 94, 95.
94, 27, yeah.
Okay,
I think 26.
my children are born about that age,
Oh,
about that year. And glad to know that we are both graduates of Holy Spirit School. I was also
yeah.
but you're pretty young, and I finished my high school, kindergarten to high school there, and taught for a year on my first year of teaching at 20 years old before I moved to HNU. But I also took a second course after BS Bio, so of nursing in HNU, and been teaching, but not in the nursing department. So at any rate, there's a little that I know about
The medical field.
RadTech. So it will be a lot of learnings this afternoon. So I'm really excited. Little experience with, although I do have regularly my 2D echo is a part of that.
Yeah.
I've been through MRI,
Hmm.
X-rays, and
Yeah.
ultrasound, but other than knowing and getting the results, I pretty much do not know anything that, like the behind the scenes, other than seeing that report. Okay, so very excited to know what this new program at HNU is about. So thank you for that sharing. At a very young age, you have already had a lot of experience, not only in the practice, but also in teaching. And I understand that you are bringing a lot of new, like information and your youthfulness into the program. So BS Radtech at HNU, the newest program that they are offering. I'm interested to know, before we go into the usual questions on the course, tell me, what are the job opportunities that are available when the students graduate from Radtech? You already said
Um.
about your teaching, but
Yeah. Yeah. Obviously, number one for the teaching or the academe. Number two is in the hospital or in the clinic, or you can be also an administrator, a businessman if you will. If you're planning to build your own diagnostic facility, like for X-ray or CT scan, in an instance. You can be a radiographer in the field, because in radiology, the field of radiology, there are many sections. It doesn't only entails X-ray or the general radiography. It also has, you can also be assigned, because there are some hospitals that there are different rad techs for X-ray. So if you're in X-ray department, you're only in the X-ray department. Lucky for you if you're in the hospital, like our hospital here in ACE, that you will be rotated into the different modalities. So you can handle X-ray, You can be taught or trained for CT scan, MRI, mammography. But in other hospitals, they are strictly like, for if you're trained for mammo, you'll be going to the work for mammography. And if because in some hospitals, as I know, in Cebu, I'll not mention names in particular, but once they apply for a rad tech, being a fresh grad, you will be first assigned in the X-ray department. So you will handle X-ray and fluoro, and then the C-arm, of course, the portable procedures for X-ray, and then you will also, as time goes by, if there are available slots for CT scan or MRI, you will be assessed if or you will apply in other hospitals. I have heard that kanang you will apply in their department, and if you will be accepted, then you will work there in the CT scan. So it will be a case-to-case basis as to what field or section in the radiology department you will work. As what I said, lucky if your department will let you rotate um, every month or depending on the schedule. So things like that. You can work as a in the hospital, and there's also clinic and both private and public hospitals.
Okay. And pretty much there is like a general like, can we call it general practice, and then there are specialized
Yeah, because for being a rad tech, your bread and butter will be X-ray. So you will be trained in CT scan, though you will be able to like see a glimpse or a little, like you can handle it. It depends on the institution when you will become an intern on the fourth year.
Okay. Wow, thank you very much. It's I know it entails a lot of specialized training, like and you have to be very very smart to undergo all these trainings and procedures. But so I understand. So when you graduate, you can be in a hospital, for example. There will always be at least how many?
There will, depending on the machine. The Department of Health requires one rad tech, one machine per shift. So basically, if you have like 3 shifts and then a single X-ray, so it entails 3 rad techs in a day.
Okay. And then someone else does the others, like if you have
Yeah, CT scan. Yeah.
okay. Okay. Wow, thank you very much. So seems like a lot of also even in the city, there's already a lot of diagnostic
Yeah.
and
Mm.
especially in Cebu also a lot of
Yes,
diagnostic centers. So they can also
pretty much.
be employed there.
Yes, they can employ their they can also be an RSO or the radiation safety officer. They can also take trainings for that so that they'll be a certified RSO.
Okay. Oh, and so that's what it means on your
Yeah.
health card. It says Raynadel Dinorog R
Art.
RRT and RSO.
Yeah.
So RRT is the registered.
Radiologic technologist.
Okay,
And
that's when you
then
take the board. After you take
yeah,
the
yeah.
board and pass, that's the license that you have. And then
The RSO is the training, like radiation safety officer. Then there'll be like certified you'll be certified. But prior to be being certified, you will pass different requirements depending on the requirement of the one who handled the certification. But there's only one common requirement, as I know. You'll be able to make a manual, radiation safety manual, for a certain institution.
you will qualify, you will apply, and then be certified for that.
Yeah.
Okay.
Mm-mm.
Wow, thank you very much. So each hospital would have, I would think, would have an RSO also.
Yes, basically. Yeah.
Wow, thank you. So let's move on to talk about the BS Radiologic Technology program of Holy Name University. Tell me, what is the knowledge, what are the knowledge, skills, attitudes, or the major subjects? What do we learn in there? How many years does it take, and what do they do within that time that they're enrolled in the program? Thank you very much.
Yeah, thank you, Mom Bear, for that. Radiologic technology is a program, 4-year program. The first 3 years is a didactic theory, and the last year will be a clinical education undertaken in the different affiliated hospitals. So, in the first 3 years, it doesn't mean that it's only on books on theory. There is a laboratory that must be found in the university. It would be an X-ray laboratory that would be used by the students in taking different experiments and exposures for them to be honed into the professional or into the they will be presented as to what is the bread and butter for being a red tech. And then educational I mean clinical education will be a great opportunity for you as a student or an intern to be there. You can see the modern facilities in the hospital. You'll be able to handle patients with the guidance of course, of the red tech there. And then you'll be presented with the advancement in the technology and the global competitiveness of the field of radiology, because our field is continuously advancing, or
Right.
every year, every how do you call that? I mean season. I don't know, but there will be a continuous advancement of the machine from one era to another, and so there it would make your life easy. And
Okay.
then in the being the Department of Radiologic Technology, you will be able to have the first year for general subjects, and we have one major subject for the first year in the first sem. It would be the introduction to radiologic technology. You will be presented there. What is the red tech all about? You will be presented with the different. You'll be introduced to the different fields of radiology, to the different subjects that you're going to take, to the different, code of ethics, things like that, the rules that governs are the RA 7431 that governs the profession. And on the second SEM, there would be medical term, medical terminology, and the heavy loads of professional subjects or the major subjects will start in the second year until the third year. They will be also required to accomplish a research paper, but it would be on the third year of the educational year.
And then the fourth year is
A
when
fourth year will
they
be the internship, and then after that they will graduate, they will take the review, and they will take the board exam for them to become a licensed radiologic technology here in the Philippines.
Okay. Wow. So it takes 4 years. First
Yeah.
year, you already have the major subjects in the first sem, second sem, and then you go second year, third year, and then fourth year is when you go into the our affiliated hospitals. Yes.
Mm-mm.
Okay. So pretty much like our nursing program. That it goes through that 4-year course also. So since this is a pretty new program for HNU, can you tell me how many are the pioneer students in the first batch?
There are basically two sections in the first batch taking up the course, so there are much a bundle of them.
And so there's if we have about 40 each,
Yeah,
for the
about
first batch.
80. Mm-mm.
Okay, thank you very much. And you were not a part of the K to 12 program yet. I think
Luckily, I was not able to join that K to 12.
you missed that. So, but anyway, this batch right now would probably most likely or 100% graduates of K to 12, and would you have an idea if they're all like STEM or in the different?
Um,
Yes.
Basically, they're not all from STEM. Some of them are gas graduates. Some
Okay.
of them are
Mm.
UMS. Is
Mhm.
it UMS?
Yes.
So yeah,
Yes.
I'm not
Yes.
I'm not familiar
Humanities,
about it.
humanities,
Yeah, that
and social
humanities.
sciences.
Mhm. But they're taking the bridging for
Mm.
physics so that they will be able to take the profession. I mean the course. Sorry.
Okay. Yes, yes. So that's for those
Mhm.
that did not have physics in physics in the senior high.
Yeah,
But I guess it's embedded in the course, so it's really not like a, like a different uh, subject that they have to take.
yeah, yeah.
Okay, so thank you very much. Now, since we're still on the first batch, we're still on the first semester, and the students are all online, huh? No face to face.
Yeah.
Okay. So these two batches, these two sections rather, are still, like online, Google Classroom, pretty much like the other courses at HNU.
Yes, ma'am. But we are doing because we are allowed to take synchronous classes.
Yes.
So I'm having a once a week synchronous classes to check on my students. It will also greatly help their mental health, and um, they will feel that they're a student, and then things
Yes.
like that. Then it's for me it's an essential that I am having a once a week synchronous classes for them, for me to really assess how the student is going.
And like the nursing or the BS nursing and medtech, was there like a cutoff grade, like required 85 or top how many percent of the class to get into
um
or okay, thank you very much.
our passing grade is 75 or the 3.0, and
Okay.
then yeah, that's it.
Okay, thank you very much. It's good to inform the others because especially the our followers and those who are not aware that we do have we have really started to offer starting this semester the BS RadTech program, in addition to the BS Nursing and the BS MedTech, Medical Technology of the College of Health Sciences. So I'm very proud, and I want to greet the students that are our pioneer students.
Yeah,
Yes,
they're the,
if we have names like Hildegardians for nursing or Escalapians for my fifth batch in nursing, do we also have a name for them or not yet?
not yet. Oh, thank you for reminding me. I will be glad to ask them.
What their names would be, no?
Yeah, because
Um,
they're on more millennial than me.
and then is it do they also have like a capping or badge pinning? Do you also go through that, or they just all of those that pass will move on to second year, third year, fourth year? How does that work?
Um, on my college years, I was not able to experience that capping, the pinning, the ring hopping, things like that. But I'm planning. But of course, I will ask the consensus of the students because it's not just me. So I'm going to ask them if they're willing. Then I'll be open for suggestions.
Okay. Well, thank you very much. It's very exciting because as the youngest
Oh yeah.
program at HNU, we're very excited to see how these whole 4 years look like. So I hope that the students that are currently enrolled are watching and getting to, like also excited as we are, and the parents also. So first year, First year, there's already a major subject. Second year, there will be more. What are the major subjects in there other than the ones that you mentioned?
On second year, there will be radiation physics, there will be radio anatomy, there will be positioning. There will be, because on the third year there will be more on the radiologic sciences, namely MRI, CT scan, ultrasonography, nuclear medicine, radiation therapy, interventional radiology. But on the second year, there will be like computed radiography, because on the new curriculum there's added subjects. So there are new subjects being added, and then there are like information something, and there is computed radiology. There is also the positioning subject is being halved into two. Before it was just good for one sem, now it is being halved since it's so long. And then conscious subject is on a separate unit. And then venipuncture and patient care are two different subjects now also. So in the subject, in the course, they will also learn how to insert cannula through the venipuncture subject. They will also learn how to handle and transfer patients through the patient care subject. They would also learn how to manually and automatically process films through the automatic processor and the manual beams through the image processing subjects. They will be able to know the different, the parts of the X-ray machine, how X-rays are produced, because they will also know the different mechanics or the technical or the electrical details about the X-ray, and they will be able. There's a little math on radiation physics, on conversion of units, things like that. And what else? What else can I add? I think it's the most basic one.
Okay. Wow. And I was struck on what you said, that there are changes. There are new,
Yeah.
all the time. So it would entail, like really constant education, constant training, updating of yourself, attending trainings to, especially on new stuff, new information, new
Yeah.
technology. Wow, thank you very much. So I'm glad that at such a young age, you are very conversant and very, like have really gone through that process.
And now we're also undergoing ongoing construction for the X-ray laboratory. So the students, I hope so that there will be a face-to-face as soon as possible, so that they will be able to see and handle the machine before they will become an intern.
Right. Yes, there really has to be the baby steps that they have
Yeah.
to go through. I remembered when I was full-time teaching, and I
Hmm.
handled the first year, like zoology, and how you the the at that time you have to dissect the frog. And I always said that if you fail this class and you want to be a nurse, you really have to make sure that you pass this class, because how can you, if you have to inject on the deltoid, or you and you have to you're asked to, like whatever procedure, you have to know your basic anatomy. So understand that uh, probably also in radiologic technology, that is also important, the human anatomy at least.
Yes, there will be a human anatomy and physiology subject, and then there will also be a radio anatomy subject. So
Right.
there'll be basically two anatomies, and anatomy is like the bread and butter, because you must know where exactly the part of the machine. The part or the bone is located. So, for instance, where is your heart? So you must know the landmark, since you cannot
Yes.
really see where is your heart. So you will just we call it in our field surface landmarks. So like also there are different surface landmarks in your body, like here in the sternum notch and in your T7, things like that, so that you will be able to capture the different procedures, for example, chest x-ray. So the human anatomy subject is a must, really.
Yes, you really have
Yeah.
master uh master that part so that it's easier to understand, like as you go higher up in the ladder, uh easy to like remember, easy to carry out the procedure because you have mastered that part. So thank thank you very much.
Yeah, yeah.
Are there other things like so what are examples of like the thesis that the students have to do uh, in their in this program?
Thesis may be quantitative or the qualitative or the experimental. I mean, descriptive or experimental. Let me share you during my college years, way back 2014, I think, or 2013. Forgot. Yeah, I think 2013 to 2014. We were being grouped according half in the class. I don't know how many, I forgot, but so we took experimental. We studied about the stop bath, the different kinds of water to be used as a stop bath, so things like that. It may be also um, descriptive, quantitative in particular, just like what I'm doing now with my masteral class. I'm doing a descriptive and a quantitative for the job satisfaction and organizational commitment as a predictor to turnover for radiologic technology here in
Oh,
our city. So I'm on the process of completing it.
wow, sounds interesting, and
Yeah.
would really be a help to know uh,
Mm.
so that the program can be improved or like enhanced. So thank you very much for sharing.
Yes.
Now so after the so in the fourth year, so the thesis or the research would be on the third year or the fourth year first sem, or it's in the third year?
Um, Thesis would be on the third year.
Because the fourth year is
Pure.
dedicated to clinical uh,
Yes.
and but this is purely hospital setting or diagnostic center setting, no community, huh?
There will be no community setting. It will be purely all on hospital affiliated duties. So there will be different hospitals that we are going to affiliate. And of course, Holy Name University Hospital is one.
Yes.
Yeah.
Okay, so and so they will be how many is that a required there a required number of hours that they have to do that? Are there required procedures that they have to, like for example for nursing you have five assists, five
Mm.
major five delivery stuff like that. Are there also something like that for radtech?
Yes, we have clinical education manual in the fourth year that you need to accomplish, but need not to worry because I know that the chest PA or the thorax part of the X-ray would be accomplished in just like 1 week of your single affiliation, because chest PA is the bread and butter for our
Yes,
profession.
yes.
Yeah.
Mm.
And then let me add that, for example, for MRI assist or the CT scan assist, you also need not to worry because you will be exposed on the duration of 1 month per modality. So for an instance,
Mm.
in that in HNU will be assigned 1 month there handling CT scan. Then in just an example, because we still haven't drafted yet. So example, 1 month there in X-ray, 1 month in CT scan there in Holy Name University alone. So that entails 2 months already. So what else? You'll be exposed 1 month for nuclear medicine, radiation therapy, ultrasonography, and other affiliated hospitals like MRI, and what could the hospital offer to us?
Okay. Wow. So, pretty much our hospitals in Bohol already have all of these, um, you know, uh, procedures.
Yeah,
Offered.
pretty much, because MRI is now available in both. I think it's already available also in Galeares, and
Mhm.
I'm pretty sure it's already available in ACE, Bohol, and so as to the mammography there and CT scan. There are a bunch of hospitals here already, and most the bread and butter, of course, the X-ray.
For a long time has been the one that is available.
Yeah, X-ray, really.
Yes. Okay. So I forgot to ask earlier when we started, what is the value or uh, what is the value of the RadTech to the medical, to the entire medical field, or to us, our health and like our life? I forgot to
Yeah,
ask
I'm
that. Okay.
yes.
What is the value to the medical profession? Doctors are very dependent on that. Yes.
Yes, basically, you will do diagnostic procedures, which is vital in the management of patient, both diagnostic and therapeutic. So you'll be given, it's vital because, for an instance, you are going to capture an X-ray, and just like when you took a picture, diba, you will do angle to get the perfect picture of yourself. So just like X-ray, you must do the perfect shot, angle it, position it properly, angle the tube properly, so that you will get the perfect shot for that certain procedure. Because if you place it in an oblique and you intended it for a PA, or the posterior anterior projection, then it would be a different story. It would be a different picture once you'll get it. So it's really vital for you to know positioning, for you to know how to manipulate the equipment, how you handle it, how you handle the patient, most especially in trauma cases, because they're handling trauma cases and ambulatory patients are two different stories. Your skill as a rad tech and knowledge should be tested, because in the book it's being stated there as the ambulatory patient. So, or for an instance, a motor vehicular accident patient came in, so asked for a hand X-ray, so he cannot move his hand. So you, as a rad tech, will use your skills and knowledge in order for you to like strategize. How are you going to get the perfect angle for the hand? Things like that. And then for CT scan, for babies, CT scan procedures require babies not to move. So it's for your rad tech, how your strategy, and how are you going to let the baby like fall asleep or play something, so that you'll be able to scan the patient.
Yes. Thank you very much. And on the overall, also for the uh, like in a proper diagnosis of certain diseases, uh, that is where the really the importance of the work of the RadTech is needed.
Yeah, because pictures are the radiographs. We call it as radiographs. The radiographs will be sent to the doctor. They're the radiologists who are going to interpret the radiograph, and then, for an instance, you're getting the wrong angle or getting the wrong part or the view. How can the doctor be efficient in reading if you yourself as a rad tech is not competent to do the procedure? So it must start from the educational years, then it will be enhanced and put into practice during clinical education or the fourth year, and then it will you will be trained and enhance more on your professional growth once you become a registered radiologic technology in the future. So if that's the basic for RadTech, you must get the perfect view of the perfect procedure so that the radiologist can produce an efficient result for the proper management of the patient by the attending physician.
Wow. So it's really valuable. For HNU, for example, our medical technology is also helping the like the doctors in all of those the procedures that they do. The RadTech also is another vital help for the medical profession, and also the you have to work closely with like the doctors, because then they will have to like whatever is the order, right?
The
It has
process.
to be, yes, has to be carried out as ordered by the doctor.
Let me add, yeah, we're going to closely work with the doctor, but in general, we're going to work with the entire healthcare team. It
Right.
doesn't only, yeah, because for an instance, we're going to work with a nurse to insert with the IV cannula. If you're not an IV certified IV therapist, then you will also work with the medical technologists for your creatinine results for conscious media procedures, the one that's needed for a dye that will like if enhance the contrast of your study. You will also greatly need the pharmacist for you to ask whether if this medication has metformin or not. You will ask for an advice with regards to the medications. You will also work with the doctors for their procedure and clarify it, and the medical physicist for the dose, things
Wow.
like that.
Wow. So thank you very much. Sounds it's really an important program, important field that I hope that since I believe it's is it the only one in Bohol, or the first in first what you call this in Holy Name University. So thank you very much for sharing. Hold on, turn off. Hold on, I'm live on. Oh, come on. Okay, ito hindi ko off. Okay, hold on. Okay, so oh, okay, thank you very much. Sorry about that. I had to anyway. I like to proceed with like the question, this favorite question: why HNU?
Oh, that question though. So, Holy Name University, as I've known, will not only mold you into the professional that the community needs, or into a competent professional, but Holy Name University will mold you and uphold you in being true witness to Christ the healer value, meaning spiritually, you will be molded into what a Christian is, and you will be able to reach out different communities. And also, Holy Name University will give you formation of competent and socially responsible healthcare professionals. So it's a complete package.
Right. Thank you very much. And I hope that we are able to invite new students since and future enrollees, knowing that we have this
Yeah.
new program offering at Holy Name University, and that we will be able to like increase or add more to our like especially the next batches. So thank you very much for sharing. I'd like to inform our audience some of the announcements. On Sunday, it will be Holy Name University is the venue for the licensure examination for teachers, the board exam with in uh, by the that will be given by the Professional Regulations Commission, the PRC, and it is we are very happy to host it on Sunday. So we would like to inform our audience that HNU campus will not be open to the public except for those who have the like the permit to take the test. We have about 700 examinees expected, plus about 100 proctors. So hopefully they will be able to do that safely in the campus. On Monday at 3 p.m. we have the webinar with Ambassador on the 27th with Ambassador Frank Simafranca, our alumnus from Holy Name University, who is assigned in Hungary. So that's for the political science classes, and that will also be aired live on Friday. That's the 1st of October. We have In Focus for BS Biology, and every Friday after that will be the different programs of the different colleges of Holy Name University. So I invite everyone to I want to thank everyone for watching us, for joining this episode, inviting you to join us in the succeeding episodes every Friday at 2 p.m. And there will be other programs that we will also be having at that time. So before we close, may I request Ms. Dinorog for her closing statements.
Hi everyone. I'm inviting you to the program of Radiologic Technology, and I hope it will bring what the community needs, and it will surely bring you to what the world of radiologic technology is with our state-of-the-art X-ray laboratory here in the campus, and with our state-of-the-art campus with a complete facility, and it will surely hone you into the person and into the professional you want to be.
Wow. So thank you very much.
Thank
This In Focus episode is live on Facebook, and the file will be there forever. The recording will be uploaded in the HNU YouTube channel tomorrow, and then the audio file will be in DYJR Johnson Radio 106.5 FM. Thank you very much, Raynadel. You're as old as my children. So I'm very happy and very grateful for the chance and the time that you have given, and I'm very impressed at how conversant and eloquent, and the information that I learned today. There's a lot, and I will be supporting you. I hope that I will hear from you and be able to partner with you in your information sharing with your students, and of course of the program and of our parents. So thank you very much.
Thank you so much, Ma'am Vera. It's my pleasure also.
Yeah. So we did not, Miss Mom Joy, the dean, did not make it, but I hope that everyone, the CHS, College of Health and Sciences, are also watching, and that our administration and staff, faculty and staff are also watching to be able to share this information with our stakeholders. With that, we say thank you. Good afternoon, everyone. Have a pleasant Friday and a wonderful and relaxing weekend. Thank you.
Thank you.